We are back now answering your coronavirus vaccine questions. Our experts are Keith Grant, Senior System Director for Infection Prevention at Hartford HealthCare, and Dr. Melisha Cumberland, Chief of the Department of Medicine at Wyndham Hospital. They both were vaccinated earlier this week, and many of the questions coming in have to do with allergies. We saw the reports out of England that a couple of people with pre-existing and significant allergies there did react to the Pfizer vaccine. And then there was the woman in Alaska who reacted. So as you can imagine, some people are concerned. That leads us to our first question. Pat in Andover saying, since there are known allergic reactions to the vaccine, will there also be allergy tests for the ingredients in the vaccine so that we can evaluate our risk? Mr. Grant, what do you say to Pat?
Pat, that's a good question. So, when you look at a Pfizer study, allergic reaction to include anaphylaxis was an exclusion criteria. For individuals who have history of allergy, what I would recommend and what we've been recommending in the healthcare communities, have a discussion with your healthcare provider and see what the risk is and how to mitigate that risk. There's many processes to put in place to ensure that you're safe through the process. But as it stands right now, if you have an existing allergy that includes anaphylaxis, please seek medical attention or advice before getting the vaccine.
Makes sense. Marisol in Gales Ferry wants to know if the vaccine contains mercury. Some have asked if it contains thimerosal. Dr. Cumberland.
So it does not. I'll take that.
I apologize. I believe I was still muted, but it does not. The vaccine does not contain mercury. It does not contain thiazine. Just to be aware of that. So. It does not, so it's safe in that sense, yes.
Okay, good to know. Another one for you, Dr. Cumberland. Judy in Newington has a question about specific allergies and possible interactions. She asked if someone is allergic to peanuts and tree nuts, should they get the COVID-19 vaccine?
So along with what he was saying earlier is that with mild or moderate allergies, we do still recommend the vaccine for people with peanut allergies, shellfish allergies, and so forth. We do ask that you stay for 20 to 30 minutes thereafter receiving the vaccine to monitor for any reaction. However, if you have severe anaphylaxis, what we call it, severe allergy reaction, we do recommend that you discuss it with your allergist before proceeding, and because it's worth the discussion before.
Based on what you just said, I think we know the answer to the next question, but Keith in Quaker Hill says, I have a severe allergy to shellfish, primarily shrimp. Does the vaccine have any shellfish derivatives?
It does not have shellfish derivatives. However, again, if you have severe allergies to anything, anaphylaxis, again, being that severe allergy term, do not take the vaccine until discussed with your healthcare provider.
Okay. Another set of concerns we've been seeing, and the question sent to us involves existing medical conditions. Are there any conditions that would prevent you from getting a vaccine? Jean in Newington asks, can people with type 2 diabetes take the vaccine?
Gina, that's a very good question. In fact, individuals with type 2 diabetes, with diabetes in general, have been seen as one of the high comorbid conditions that has led to some degree of mortality through this disease process. So individuals such as this, I would encourage strongly to definitely seek and get the vaccine. Within the Pfizer study, there was a number of comorbid conditions to include diabetes that was studied with very, very good impact, good effect.
Okay, we have about 30 seconds left. Robin from Meriden has our next question. She asks, is the COVID vaccine like the flu shot, where if you have symptoms or if you are sick, you cannot get the shot until you are not sick? So basically, if you are under the weather, do you delay getting the vaccine? Mr. Grant.
So generally, if you're acutely ill, so if you're in a hospital acutely ill, I would delay getting the vaccine. If you are, under the weather, perfectly fine to get the vaccine generally, yes.
All right, good to know. On the other side of this break, concerns about women getting the vaccine. Should young ladies be worried about possible issues with babies they have years down the road? And what about pregnant or breastfeeding moms? Your questions answered after this.